there was one week in particular where it was really, really bad. And it happened to be the most professionally successful week of my life. And I remember sitting there in the hospital at the trauma ward in Lionsgate Hospital in Vancouver going like, if this is success, then forget it. I don't want it. I just want to be healthy.
Welcome to the Multiverse, where we believe that mushrooms can actually save the world. Each week, we'll be meeting with thought leaders and experts to extract the best insights and stories across everything from functional fungi, psychedelic medicine, and so much more. Thanks for listening. Step into the multiverse with us. Hi, everyone. Welcome back to Into the Multiverse. Today is a really exciting conversation. We're sitting down with Payton Nyquvest, not Nike Quest. Not Nike Quest. There's been a lot of mispronunciations, I'm sure. But Payton is the founder and CEO of Numinus, and he's going to explain a little bit more about what Numinus is, but they're a publicly traded psychedelic company. I'm really excited to be talking with you today. I have a long list of questions that I'm sure we are not going to get to, but I'm really, really excited about the work that you're doing, the people that you're connected with. And to start, before we kind of get into what Numinus is, I think it's really important for people to understand why you started it and how you landed here. So my first question to you comes from inspiration from a podcast I was listening that you recorded a few years ago. And you said on the podcast, the most successful week of my life, I was in a hospital all week. And I just thought that was really interesting because so many people I know are really, when they reach the height of their success, their health is at the lowest it's ever been. And that was a lot of the inspiration for you to go on that journey.
Yeah.
So I'd love to hear a little bit more about that to start.
Yeah. Where would be a good place to start? I'd suffered with chronic pain my whole life, really since birth, and grew up in a household that struggled with a lot of mental health issues, a lot of addiction, and sort of I would say the big first catalyst for me in terms of really looking at my mental health was my mom got sober when I was 12 and really opened my eyes to people can change significantly by working on their mental health. And so as a teenager, became very passionate about working on my mental health. I had this like consistent driver in my chronic pain issues, but became, just very serious and dedicated about how my mental health was affecting my chronic pain or vice versa, and really stayed dedicated to that. And sort of by default became something of a mental health advocate in my community, really twofold. One, I had a bunch of friends that I thought could benefit from the therapy that I was doing. And two, I didn't want to be the only teenager in therapy. So I was hoping some of my friends would join me as well. But my chronic pain, no matter what I was doing, continued to get worse and worse and worse. And got me to a place where I was getting hospitalized a couple of times a week, couldn't get a proper diagnosis. I ran like every test that it was
stomach pain, right?
Yeah. So severe, it would start as like severe gut pain and then just sort of manifest into just pain, like just overwhelming pain. And the way that essentially I ended up getting treated was a rush to the emergency room and opiates, really, to get put on hydromorphone until the pain would stop, and then they would send me home. And it's a really, it's a very lonely place to see healthcare practitioners looking at you going like, we don't know how to fix what's going on for you. And it's very desperate feeling. And I had never tried psychedelics. As I said, I grew up in a family that struggled with addiction. So I was always cautious of that, but I'd researched psychedelics for like a year and a half. And as you said, my professional success, it was sort of like my chronic pain continued to get worse as my professional success increased, and got me to a point, as you said, that there was one week in particular where it was really, really bad. And it happened to be the most professionally successful week of my life. And I remember sitting there in the hospital at the trauma ward in Lionsgate Hospital in Vancouver going like, if this is success, then forget it. I don't want it. I just want to be healthy.
And what
And
were you working in for context? You were working
yeah,
in financial
I was
industry, right?
I was in the finance industry, primarily funding like new startup industry. I was quite involved in the cannabis space, and at the time, I was actually managing a brokerage firm, one of the larger independent brokerage firms in Canada. I was running their Vancouver office, and I was a director of the across Canada firm. So a lot of stress, a lot of responsibility, especially as a young person. But actually, so through that experience and through the research with psychedelics that I had done, I booked a flight to Costa Rica while I was in the hospital. Got out of the hospital, packed my bags, and got on a plane and went and did ayahuasca, which was the first psychedelic that I had ever done. And through that experience, saw the first relief from my chronic pain that I'd ever had in my life, really. And that really sort of set a trajectory of now Numinus and sort of where we are today.
And was it immediate? Did you go have that experience and then walk out feeling better?
Yeah, I mean, I always hesitate to. I never want to like over promote psychedelics because there's certainly
Right.
risks associated, and there's certain people like there's people that can benefit, and it's not a panacea, it's not a magic pill. But for me, um, as I said, I went from someone who's being hospitalized multiple times a week to I haven't been in the hospital since, and that was just through that 1 week with ayahuasca.
Wow.
Yeah, yeah.
So fast forward to now,
Mm-hmm.
you started Numinus, and I was just telling you before we started recording, it was really interesting because as I was, learning more about you, I listened to podcasts, a few different ones that you did, but one right when you were starting. So it was really cool to hear the vision for Numinus
Mm-hmm.
and what you were building versus what where we are present day. So can you share a little bit more? I think it's fascinating. There's a lot of companies that are getting into this specific space, and I'm so excited to have this podcast so I can learn more about what everyone's doing, who they're partnering with. What is Numinus, and where are you guys at right now?
Yeah. So the focus of the company has always been how do we provide and develop psychedelic therapeutics? So whether that's products or services, and how do we make them accessible for people? So that's sort of working along with research institutions, but also setting up the necessary infrastructure to be able to actually take things out of a research context and into a real life practicing setting, but not discrediting or making sure that there is research that's being done there so that, if I'm a referring GP or something like that, there's data there that can educate sort of the medical community as well. And so we do that twofold. One is Numinus Health, which is our clinical infrastructure where we do a host of just mental health services, as well as now ketamine assisted psychotherapy for a number of different indications. And also, we have a partnership with MAPS to be doing some of their work with MDMA for post traumatic stress disorder. And we have a couple of different research protocols with psilocybin for substance use disorder. So integrating those within the clinics, and the focus with the clinics has really been, you've seen this huge interest in ketamine. Our focus has really been how do we build psychedelic therapy clinics, not just ketamine infusion, but MDMA and psilocybin, which are obviously fairly significantly different therapies than ketamine might be. Psilocybin and MDMA is a 4 to 6 hour sort of experience. So our focus has been really looking at where we believe the psychedelic industry, which feels weird to call it a psychedelic industry. But
Because when you started, there was no psychedelic.
there was no psychedelic industry. Yep. Yeah. So is really how do we provide these containers to be able to house all of the therapy, but also the supportive practices. We were talking about community, even group work. And how can we create a community around psychedelic therapy to really be able to hold people well and intentionally through this work. Then the other side of the company is Numinus Bioscience, which is our lab, which sort of looks a little bit like this. Our lab is sort of like, I call it like psychedelic Disney World. We've been licensed by Health Canada to do not only analytical testing, but also production, importation, and distribution of pretty much all psychedelics. So MDMA, mescaline, psilocybin, DMT, LSD, ketamine, and also that's international licensing. So we can work all over the world with different groups. And Health Canada amended that license about a year and a bit ago to allow us to harvest, cultivate, and extract psilocybin from naturally occurring psilocybin containing mushrooms. So most of the work done to date with psilocybin has been synthetic, and we've been able to actually start to create natural psilocybin products, which really sort of doubles down on our focus around accessibility. From what we've seen, we can produce something that is potentially 75% cheaper and keeps all of the standards, so it can be used by the FDA and by Health Canada. And what we've seen with, Mother Nature's been working on psychedelic drugs for quite some time now. So we think Mother Nature's got it pretty well figured out. And what we've seen with natural psilocybin is there's other compounds within psilocybin containing mushrooms that have therapeutic benefit. So everything from well-known things like melatonin and serotonin, all the way to now we've started to discover previously undiscovered compounds within psilocybin containing mushrooms that have therapeutic benefit. So that's some of the research work we're doing out of the lab right now.
It sounds like you guys are doing, not only are you're starting just with ketamine because it's legal right now, but you're building out the service centers, but you're also doing all this research on, kind of dissecting psychedelics and figuring out how to make them more accessible, which is a huge part of your mission. Can you speak a little bit, because all the stuff we just went through is like how you guys are doing the business model, but what is the mission behind Numinus? Like in kind of tying together, like you started this because of your personal experience with ayahuasca, came out of that, realized how powerful psychedelics were. But what is, whether it's company mission or personal mission, like what is the mark that you hope it has on the world?
Yeah, again, accessibility and not missing the community aspects to this, and not missing the level of, a lot of what we talk about as well is there's deep indigenous relationships with these medicines that go back thousands and thousands of years. And to make sure that we're interweaving indigenous practices, we always talk about like the art and the science. And that's really been our focus, is having that scientific rigor to make sure that there's the necessary data points and depth to what we're creating, but not missing the art of psychedelic therapy. And if you look at the partnerships that we have, whether that's with MAPS, the people who work with us, there's a deep understanding of psychedelic therapy and what that really entails. And so for us, it's really been about accessibility. Yes, treating serious indications, but also as we look, towards the future, the way we treat mental health is so much we wait until you're depressed. We wait until you're anxious. We wait until you're suicidal. We wait until you're addicted, and then we start to treat you. What about preventative mental health? What are we doing to make sure that people don't get depressed? What are we doing to work on mental wellness for people? And we think psychedelics have a really interesting role there. And I think there's certainly a pathway to that. I think really, the people who are really suffering need support and need help, but also let's get people well, and let's try and get ahead of, the suffering is suffering. There's always going to be, that's a part of the human experience. But how do we try and get ahead of this, now mental health crisis that we're in at the moment?
So that perspective is really important for, I think, a lot of the companies that are leading the charge in this space to have. And I want to ask you a question, and I want to give a little context to the question.
Sure.
Because you speak a lot about, everything you just painted a picture of is going about business with integrity, right? Like staying connected to the mission and making sure that you're doing things for the right reason. And earlier this year, when you recorded another podcast, you had said you really were observing that there was a lot of integrity in the space. And, so the question's kind of twofold, like whether you still think that's the case based on recent events and things that are happening. Like there's, so many people I know from the time we started working in the mushroom space and building, a mushroom marketplace, it's just been an explosion of functional mushrooms, psychedelics. It's everywhere.
Mm-hmm.
And in large part, that's because of the massive business opportunity that's in it.
Yeah.
And so the context I want to paint behind the question, it's a little bit of a, it'll come back. But Patagonia is an incredible company, and I love referencing them for how I would love to go about business, because they make decisions that are against their bottom line because they're standing for being an activist for the environment. They go so far as to tell people not to purchase their products, because they want to teach people about the longevity of, the hoodies and stuff that they sell. They've recalled products that they realize damage rocks. I'm like, I might be botching the example a little bit, but that only they would know about because they're so integrity with their mission. And as we're having a lot of these companies come into the space, there's like this really interesting balance of, you obviously need money to fund the business, and there's over 100 for-profit companies, something along those lines now in psychedelics. But the balance between, integrity and staying aligned with the mission, and having to keep your promises to certain investors that are pushing you in a different way. So just like curious if you still think there's integrity, and then like given that context, how do you guys approach how you make decisions?
It's a great question. I certainly think that there's still a lot of integrity. I think, if I'm being really honest, I think there's a level of naivety in the space as well. I think most groups that I see are there for the right reasons, but maybe don't fully understand what psychedelics are all about. There's groups that are looking to try and patent the molecules. There's companies that are trying to develop psychedelics without the psychedelic effect, which to me speaks sort of to somebody that maybe hasn't had a psychedelic experience before. There's lots of metadata now that really points to the depth of the psychedelic experience, really has a significant weighting on the outcome of the therapy. And I think probably one of the things that's been a little bit maybe disappointing is you saw this huge amount of money that's come into the space, which, if you look at MAPS, for example, they've been operating for 35 years on a not-for-profit shoestring budget. Everybody who works there is taking a significant pay cut. They work their butts off. And now you've seen companies raise hundreds of millions of dollars in a year. And if you look at all of the presentations of all these different companies, and they talk about like the market, and there's numbers like $8 billion market, $16 billion market, trillions of economic impact to mental health. So there's this picture of this huge problem in mental health, which I think we would all agree on. And if that's true, why are you spending hundreds of millions of dollars to try and control some drug or IP? If it's true that the market is that big, why aren't you focused on accessibility? There's more than enough work to be done, and more than enough clients to for everybody to be able to participate. And I think the conversation around money is an interesting one. Psychedelic therapy, right now isn't necessarily cheap, but it's needed to be looked at as an intervention. The same way, the thing that's interesting with psychedelics is they've proven to have curative intent. If you look at the MAPS MDMA work, 66% of people after 3 treatments no longer met the PTSD criteria. That's a cure.
It's wild.
That's it. And not only is it those people, but if you look at the population that MAPS was working with, these are people with treatment-resistant post-traumatic stress. So they've tried all other modes of treatment, nothing's worked. After that, 66% of people cured, no longer met the criteria, and over 80% saw a significant reduction in symptoms. So when you're framing that, the way we've treated people with those indications to date is we put you on an SSRI, you start to work with a therapist, and we treat you as a labeled depressed person for maybe the rest of your life. Whereas this is like, let's cure you and get you back to living a more healthy and full life. So there's a lot of work to be done by groups. We should be working on how we can get insurance coverage. I'm from Canada. We have a public health care system. How can we get public health coverage? How can we make sure that all communities have access to this? That's more of the kind of work that I would like to see. It's a hard thing for some people to talk to investors about, right? Investors want to see a return on their investment. But I would say I've been really pleasantly surprised by even the investment community. They seem to really be grasping the intentionality of what these groups are trying to do. And there's not a person on earth that mental health doesn't touch. There's, nobody gets out of sort of this life unscathed, and whether it's direct impact or whether it's a family member or a loved one, everybody has somebody who could benefit from some of this work. So that's been nice to see that integrity there. I think some shifting of maybe where some of the resources are going, I would like to see, but for the most part, the integrity stayed.
It's great to hear, especially from someone who sees and talks to so many people at the level that you are with Numinus. Inherently, people are trying to change the old system, right? Like, I used to, when I worked in the consulting world, I consulted for a lot of healthcare companies. And one of the most fascinating things that I experienced, because I was really passionate about redoing American healthcare.
Right.
I was like, I'm gonna be a part of helping change it, because I had such a terrible experience being a patient of that system. And I would, go into these healthcare companies at my job and interview big names in American healthcare, and hearing even just about their experiences with the system, and hearing about, I remember one time I heard this story and it really stuck with me. It's like, I quit my job shortly after. I was like, I'm going to work in wellness. This is too messed up. And it's a relevant example for what you're talking about, because we're so inclined to look at the profit models of what we're doing. So, healthcare is, depending on what you believe, a lot of people believe it's a profit system. It's not value-based. And I heard this story about this guy who was telling me about his wife, and he was like a major player in American healthcare. And his wife had to go in for a procedure. She went to a different hospital because she was like kind of an embarrassing procedure that she had to get done. Like they found some sort of a blip on her X-ray, and thought she had to get this really intense surgery. She went in for the surgery, and they found out that it was just a mess up on the machine. So she was completely fine. But for whatever reason, they performed the whole entire surgery anyways, because the way that they've been programmed to operate is to use the operating room because it's better for their fixed cost. And this guy was telling me that he dug into this research, and it happens an alarming percentage of the time. And that just wilded me, but it made a lot of sense because of my own experience being prescribed pills for things that I didn't need. And a lot of people are just trying to fit, psychedelics into that model where it's a for-profit model, because that's how we know healthcare. So I think it makes a lot of sense. And what you've been speaking about that I think is really important, even just in reflection of the partners like MAPS that you're aligned with. I love that MAPS is really focused on, and I think in partnership with Numinus, I think this is a part of your guys' initiative, giving MDMA to the therapist as part of their training. So roundabout way of asking the question, like, how important is it for people working in the space to have experience directly with psychedelics themselves?
Yeah, it's a good question. I'll start with the therapist first. And this is something that Rick Doblin from MAPS and I talk a lot about, is you do really need to have some kind of an understanding of what people are going through these experiences. Something that might look very challenging to someone who doesn't have any psychedelic experience might not recognize that challenge that person is going through in a therapy might be on the cusp of a significant breakthrough. And so I certainly think therapists need to have some time in the simulator before hopping into the plane, for sure. I think more broadly, and I talk a lot about this, is I think executives, especially CEOs, have to have some kind of psychedelic experience, for sure. And I think that's important because you keep a connection to the people that you're serving. I know what someone who's really suffering who's coming to one of our clinics or using one of our extractions, I know what they're going through. I've been there. And it's very hard to understand, again, the level of integrity, but also the depth of, there's this huge interest in psychedelics, and you've seen this huge uptake in things like microdosing and sort of just consciousness exploration. And I think there's a huge, huge part of psychedelics in that. But I think we also can't forget about those people that are really suffering and coming as a last resort and really in a challenging state. And I think executives have to have some experience or context to understand, how they move forward. I mean, Numinus, for me, the whole idea and everything came through psychedelics. It wasn't me sitting on my couch one day being like, oh, this looks interesting, I should do this. It was through my experiences. And I think that's helped the company stay aligned. I think it's helped us stay focused on what it is that we're working towards. And I think it's extremely, extremely important.
I think so too. And I'm having a lot of conversations with people around this specific topic because we're just trying to learn as much as we can about the industry and who's doing what and who are they partnering with and just like learning. And a lot of the conversations that I've had with certain people that are, coming from, they're coming from the crypto world or they're coming from different worlds. And that's totally fine if they're transition, like but what's the reason behind the transition? And I think that it's in some ways necessary to have people that are really equipped to scale businesses involved in this. But I think also having a seat at the table with someone who has, a lot of experience with psychedelic medicine. So maybe it's not like everyone, but it just there needs to be a seat at the table.
Yes.
And so I guess that kind of leads me to the next point of how important is it for you with diversity in Numinus? Like who do who are kind of the thought partners that you have, whether it's around you personally or around the company? Because, as is with most industries, still the psychedelic space is led by white men. And there's some incredible people in that category. But I think it's really important to have diversity. So how do you guys think about that?
It's very much been a huge topic for us, really from the very beginning, and making sure that we're creating accessibility for diversity, as well as as we were talking about before, and especially up in Canada, making sure that Indigenous communities, the land that we operate on, giving back to the original peoples of those lands that we operate on, and which we believe, when we started Numinus, it was, how do we save the world? And the world's fine. It's people that, the world will be here whether people are here or not. But it's how much do we want to be able to enjoy the land that we're on and appreciate it. And so things like diversity and inclusion, we've actually just even recently brought on a head of Indigenous relations for us as well to work with Indigenous groups and support those different communities as well. And I think, I think it's really, really important. And also, even with our therapist training, we make sure that all of our therapists have cultural safety training, that we hire for diversity in our practitioners. Someone, maybe a woman who's struggled with sexual abuse wants to work with somebody who really has a deep understanding of what they may have been through. Same.
Are you guys able to pair people in that way? Like when people are applying for Numinus, you compare them with therapists that have had similar experiences.
Yep, exactly. And so I think to have that range of experience and diversity is really, really important. Again, someone who might be Indigenous, to work with an Indigenous practitioner who's trained, who deeply understands what that person what their cultural upbringing may be, can really resonate with that person and help guide them through, their experiences based off of the similarities and connections that they have in their life. Yeah.
I want to ask about, so much of what the conversation is focused on, your work with MAPS, around phase 3 trials you guys are working with maps on phase 3 trials for MDMA, specifically in Canada, right?
Mhm.
So, and it's exclusively for people that have PTSD,
PTSD.
and
Yeah.
it's treatment resistant PTSD. So it's a very niche category of people
Yeah.
that are applying for this category.
Yeah.
It's really interesting because it's so needed, and there's so many people that are really sick that need a lot of help and are
Mhm.
dealing with all these mental health disorders. There's also hundreds of people that I know that would, in theory, fall into this healthy normal category. But
Mhm.
like, who's healthy normal these
Yeah.
days? But like,
Yeah.
it's really interesting to think about this. And I actually, we asked this question to Tim Ferriss on a webinar the other day. Our
Mhm.
question got selected, and he didn't get the full context of the question. So he answered just specifically about microdosing. But
Mm.
I'm curious from your perspective, and I want to ask everyone who's leading,
Mhm.
a psychedelic company this question about where this really interesting point where the laws for people that would fall into, treatment resistant PTSD, getting MDMA at service center or psilocybin at a service center is
Mhm.
now being looped into the same category as someone who would fall in this healthy normal category is just looking to up level their life. They
Yeah.
have minor but not diagnosable, low grade depression, anxiety, and hundreds of people I know now at this point it's helped. It's really really profound, but the laws are gonna kind of be for this put both of those in the same category.
Yeah.
What are your thoughts on that? And you can answer in the, terms of microdosing or not.
Yeah.
Like, how are you guys thinking about that?
I think, for us, when people ask me like, who is your market? I always answer with, well, 7 to 8 billion people. There's nobody that I don't think can benefit either by, again, a loved one who might need help that directly impacts their community or someone directly. I think there's a place for not only psychedelics, but I think when people ask like, well, what is the psychedelic industry? I think it's also just the way we hold and speak to people, the way that we approach therapy. It's much less of this, I'm on the chair and you're on the couch and I'm sort of this sort of directional therapy. And it's much more
Mm.
about meeting the person where they're at and having, open, authentic conversations and providing safe spaces for people to explore that. As we said, and I talked to Dr. Gabor Mate quite a lot about this, who's been an advisor to me for a very long time.
And he was a huge inspiration for you even starting Numinus, right? Like, wasn't he an early advisor?
Yeah, he was really sort of the first person to, not the first person, but someone of obviously large influence to really get behind myself and what we were doing. So I have a lot of gratitude for Gabor. But he talks a lot about trauma, and everybody has trauma. And I think for psychedelics to play a role in just the betterment of people, I for sure see that. I think, as you said, there's this treating of really serious indications right now, which I think that work is really, really important. But I think the opportunity that that's created is we've really looked in depth of how we use psychedelics to help and support people. And obviously we saw this in the 60s, human beings we're substance consumers, and sometimes we miss some of the importance of the therapeutic container just to take a substance. And I think what's exciting about this sort of more recent shift in psychedelics is there's a real depth to the way that we're looking at what these different molecules and the impact that they can have on people. So I think it's important. But I think to answer your question, I think there's a role that it plays. And I think psilocybin in particular is a really interesting. You've seen a lot of decriminalization movement. You've obviously seen what's happened in Oregon, which is much more of a more broader access model for psilocybin assisted psychotherapy. I think something similar in Canada could potentially happen where it doesn't go the full pharmaceutical route. It actually goes to more of an access medicalization model, which sort of similar to like the original cannabis medical model in Canada, which was really broad access.
Mhm.
And I could see something similar with psilocybin for sure. And I think we start to, once these drugs are approved and the regulation changes, then you can start to look at other indications. You can start to look at off-label use. You can start, similar to ketamine, right? Ketamine was usually used as an anesthetic. That's what its original use was in the medical system. Now it's started to make itself out into more mental health practices and things like that. So I see that similar pathway, but I think we want to make sure that we're capturing the significance of psychedelics and psychedelic therapy.
And do you think that expediting microdosing specifically would be not capturing the significance? Or do you think because for me, it feels, based on what I've heard, feels like two separate endeavors in a way. They blend, but like someone wanting to have access to a microdosing that they're using in a similar way as a nootropic or replacement for their SSRI or what have you, is very different from someone going in and taking 7 grams of mushrooms and seeing Jesus and coming back, transformed after this crazy life experience.
Right.
But, do you think that, and actually I'll share what Tim said in his answer, because I think you'll find it interesting. He didn't have like the full context of the question, but specifically on microdosing, he said that, maybe there's a world where you introduce certain substances like a niacin, where if you were to take too much of it, you can manage the dosing in that way. So it could maybe be legalized quicker if you could manage the dosing of it. Maybe even ketamine. Like I know there's all these low dose ketamine protocols and things like that maybe don't necessitate going through this entire experience at a service center and could reach more people.
Yeah. I think there's an interesting application of microdosing. I would agree with Tim. I think you have to think about if 10 microdoses is a macro dose.
Right.
How do we sort of manage that, even from a, do I mind if someone is out on a microdose, sort of out having, or does the other person mind? Not necessarily at all. But, we talk about bad trips, which I don't know if I don't necessarily believe in bad trips. I think there's challenging experiences. And if you're in the wrong place at the wrong time, that can have a negative outcome. And if someone is to say get a hold of, a bunch of microdosing products and then be in the wrong place at the wrong time, could have negative consequences for them. That being said, we let people drink and smoke and, do what they will with that, which has profound, like very negative outcomes, obviously, as well. So I think I'd love to see a little bit, again, I think the importance of trying to figure out how we don't miss the opportunity before, if you look at, again, MDMA, for example. MDMA was actually created as a psychotherapy tool. There was
for couples, right?
Yeah, there was 500,000 MDMA assisted psychotherapy sessions that were administered in the US before it became regulated. Then it made its way into a nightclub in Dallas, and now, regulated.
It started in Dallas. That's really funny, actually.
Yeah.
Of all places.
Yeah. And now it's regulated. So the concern is if the cart gets too far ahead of the horse again and negative things happen, and then, we sort of lose all of this momentum. I think that's the thing that I would be the most cautious about, is let's just make sure that we're continuing to focus on accessibility, keep things safe, keep people safe. And I think, I think it all has a role to play for sure.
What do you think, so on that note of, just being careful about how we go forward, and, Double Blind, who I was mentioning before, they have so much great content about bringing psychedelics to market responsibly and doing it in the right way. And I think so much, which you touched on earlier, so much of how you do that is having the right people at the table of leading these companies. And so you've spoken a little bit about how you guys have structured Numinus, but if you were to give advice to someone starting a psychedelic company or just maybe even investors, I think maybe even more so it's to the investors that are looking at how to vet their, people are investors I know are they have psychedelic experiences, and then how they're contributing to the space is picking the right people. What do they look for? Who needs to be involved? Like what's a part of high integrity psychedelic companies? Yeah.
I think, the thing that's been such a fun part of this for me is, we have people that have invested millions of dollars into what we're doing, all the way because we're a public company. And this was actually the intention. When we started Numinus, the plan wasn't actually to ever take it public. I didn't actually think there would be a space for that, especially as quickly as things have developed. But a big part of the reason, and I have experience with public companies, and the big part of the reason was we saw so many people that wanted to support what we were doing, people who had a couple $100 all the way to people with millions of dollars. And now that we're a public company, anybody can come in and support what we're doing and be a part of that. So I think in terms of what I would say to investors is, you've seen a huge amount of interest in the space. You've seen a lot of just more broad public education, which is really, really exciting. But also, I would really make sure that you're looking at groups who are looking. It's funny. I've been speaking with a lot of more institutional investors lately, and they all say, "Wow, you're really looking at this from like a 3 to 5 year out standpoint." And I always go like, who the heck is looking at this from 6 months from now? Like you'd be very short sighted in terms of, what it's going to take, but also what the opportunity is. And I think for investors to really look at who are the groups that are really focusing on their clients, the people that they're serving, who are groups that have experience in this space, and who are in, I think this is such an exciting time and opportunity to see that well-intentioned groups, I think, are going to be the groups that are going to be really successful. You bring up Patagonia. I think this space really breeds that kind of opportunity and that kind of person who's willing to continue to stay focused on that. And I think that that's really, really exciting. And yeah, to not stay short-sighted, or not try and gravitate too much to, what's the big opportunity 3 months from now or 6 months from now.
And I do think it's fairly easy to see
Mm,
based on the questions that people ask what their intention is from an investment standpoint or from, starting a company.
yeah.
In regards to competition,
Mm,
which we touched on a little bit,
mm,
but, you know, I guess it's kind of two questions. One is like, what do you think about competition in general, whether it's like specifically with other ketamine clinics and other publicly traded companies that people know about? Like, how do you interact? Are you like friends with them? Do you guys
yeah.
not speak? Do you just, how does that work for you? And then, actually, I'll save my other question till after.
Sure.
Yeah.
It's funny, the conversation around competition, when that started coming up like a couple of years ago, it was so great to have other people that I felt less crazy for what we
Right.
were doing, because we were, when we started Numinus, there really wasn't any corporate interest in the space. It was really just us. Compass Pathways was sort of just getting started at the time, but that was it. So to sort of like see other groups come up, it was like, oh, okay, we're not we're
Mm.
not totally crazy. We're still crazy, but maybe our craziness is validated a little bit or something. I don't know, um, but I think collaboration is going to be really important in this space, as you talked about earlier. The healthcare system is a big system, and I think it's just a structure. I think it's the people within that structure that really dictate which way it goes. And I think, if you look at mental health, there's been no significant advancements in how we treat mental health issues for over 30 years.
Yeah.
SSRIs were the last big thing.
Mm-hmm.
And so it takes a lot to change the system. And I think collaboration is great. Do I necessarily agree with every company's plans and strategies? No. But I think, as we talked about, for the most part, the people in the industry do have really good intentions.
Mhm.
And I think that's going to be moved by, the outcomes that our clients are getting. And I think if that can continue to be the focus, then I think that that's great. And again, you pull up any company's presentation and they all talk about these massive numbers. So there's lots of space for lots of people to step in and help out and support.
Mm.
Yeah.
Who do you think is doing it right? Like when you look at,
Mm,
and that can be people that you're personally involved with. Obviously, I know you're involved with Rick Doblin and MAPS,
mhm,
and like who do you look at as, good, or even just like good people to follow? I think a lot
mm,
of people are looking for who do I pay attention to with what they're saying about psychedelics. It's still so new
yeah,
for so many people, and a lot of the companies that are public are in massive R&D phases. So
yeah,
the actual outcomes of their work won't be shareable
Yeah.
for a few years at minimum.
Yeah.
Who do you look to, both from maybe it's like business, or it can even be personally, like
Yeah.
people that inspire you in the space?
Yeah. Obviously the work that Maps has done is incredible, and Rick in particular, his tenacity to sort of stay at this for as long as he can, or as long as he has, is incredible.
And like him, when he started, no one was listening.
Oh my God.
It's like now everyone is.
Well, not only was nobody listening,
Yeah.
but that was through the war on drugs and the amount of uphill sort of battle that he has been on, and there's no misstep with him. He just keeps charging forward, and now he's talking about stuff the way he believes the future is going. He just doesn't stop. I think that's incredible. People like Gabor Mate, the work that he's been doing with trauma, is incredible and super inspiring. And Gabor, at his age, he's writing 2 books, and he still sees people on the downtown east side in Vancouver, which is one of the more challenging areas in the world in terms of drug addiction. Those people to me are extremely inspiring. I love Tim Ferriss's message. I like the way that he doesn't overemphasize or over promote psychedelics. He's willing to take a look at the challenges with psychedelics as well, and I think that's really, really important. I love groups, things like the Ancestor Project, I think is really, really cool. I think groups that are, as we talked about, worrying about diversity, accessibility, indigenous, practices and support. I think that's really, really exciting. But really, I tip my hat to anybody who is involved in this space. It takes courage to do and start something new, especially something that has been as stigmatized for as long as it has. And to be of service takes courage. And so I really, again, do I agree with everything that everybody is doing? No, not necessarily, but the fact that people have the courage to step up and do it, I think, is really important. And I think ultimately people will dictate, who is successful and who's not. So,
yeah. No, I agree. And all the people you mentioned, I love their message, and I've loved following them. I totally agree on even the Tim Ferriss standpoint. Like, he doesn't over promote it. He speaks about the challenges. He doesn't speak to what he doesn't know, even though he knows a lot. He probably could speak to more, but he really, is an expert before he speaks on something. That's at least my experience so far. I just think that, as I'm having more conversations and we're exploring like who to partner with and who to really align with and learning, it's so important to bring together everyone that's leading these companies to learn about what everyone's doing. Because I know a lot of people that are in so much integrity. They're doing it, in the right way, but they just genuinely didn't know something about indigenous, practices, or it's out of, purely just like naiveness, not malintent.
Yeah.
And I think that's why so much of what I'm excited to be a part of and what I'd love for like us to expand to in our role in the space is to bring together people who are experts in their silos, but maybe have no idea what this other person is doing. And, that's including bringing together people that are working in, the underground market, the black market, people that are raising hundreds of millions of dollars for psychedelic life sciences companies, people that are running the clinical trials, the therapists, the doctors. Like, there's so many different players and so many different really valid experiences and opinions. But, as the Mycelium Network teaches us, we need to stay connected to one another to really raise the space.
Yeah.
And I love, what you said about competition. And I've heard you speak about it before, just in the sense, like, if there's more players in this industry, then like everyone wins. If the goal is to have more people have access to psychedelics and mushrooms and all of these things that have had such a profound impact on our lives.
Yeah. Yeah.
So a few more questions for you. This has been so fascinating, and I love getting to talk to you, and I'm really inspired with what Numinus is doing. And
Thank you.
It's cool to hear your story and your path to get here. Just to like bring it back to like a personal level on your current experience with psychedelics, how you use them, like how do they play in your, like, did you go and have a few profound experiences with specifically ayahuasca and you're like, okay, I got my insights. Now I'm going to go spread that message to the world. Like, how do you currently interact with psychedelics?
Yeah, that's a good question. I went on something of a psychedelic crusade,
Psychedelic bender.
a psychedelic bender. But I think what was so exciting for me was I had spent 2/3 of my life in therapy. So when I stepped into psychedelic work, it was like I had all of this scaffolding built that psychedelics poured into, and it was like
It was just the needle on the haystack.
100%. And it was incredible for me. Like one of the practices that has been really helpful for me was EMDR, which is a mental health practice that has a part of it is tapping. And I sat in an ayahuasca ceremony and did EMDR on myself for like 6 hours through an ayahuasca ceremony at one point. So when I came out of that, I sort of went through the gamut of LSD assisted psychotherapy, MDMA assisted psychotherapy, psilocybin assisted psychotherapy, iboga. I've sort of been through it all, 5-MeO. Twofold. One is they've all had a significant and profound effect on my life. And again,
personal life and business life or both?
Yeah. I mean, both. It's my life, really. But I also found it extremely important that I had a proper amount of experience before I was going to do anything in the space. And integration was a huge part of that as well. I have the benefit of having a lot of therapists to be able to work with because of what we do with Numinus. But it continues to be a huge part of my life. I still partake in ceremony, and it's something that I think will probably be with me for the rest of my life. Again, I think you see the importance of integration and the importance of actually taking these experiences and applying them to not only the major aspects of your life, but all aspects of your life. Life is ceremony, and I think that's one of the things that psychedelics teach you. You see a lot of people, and certainly this was a part of my work as well, is people have these huge experiences with psychedelics, and now that there's all these sort of like business opportunities connected to them, they have these big experiences, and immediately they come out and they're like, I gotta start something, I gotta do something, and you want to make sure that you're integrating those experiences as well, because stuff comes up, and so for me, continues to be a part of my life, but for me, it's a part of all my practices. I have a mindfulness practice that I do first thing in the morning when I wake up, and it's the last thing I do before I go to sleep, and it's non-negotiable. I have to do that every single day, and so I think that's sort of an exciting role, as we were talking about, that psychedelics play, is they help people reorient themselves into how to live a more intentional life as well, and all these other practices, really interweave into that as well. Yeah,
I'm excited that more people, and that's why why I asked the question of how do you use them in your current life, is because it still is pretty hush hush for people to talk about how they use psychedelics, given the fact that most of them are still illegal. But the more people I know that are normalizing it and speaking about them and speaking about how important they are as a part of their wellness routine, and it just takes the sting off of it for a lot of people. It takes the stigma off, and it makes it more approachable when you have people that are super successful leaders in their space. They're not these like granola hippies from the 60s, which is still, we're in a bubble, right? Like we're sitting in Marina Del Rey in LA in California. Like this is a bubble. I'm from St. Louis. I don't know what your home life was growing up, but it still is a massive stigma for most of the world, even though in our communities it feels very normal. But the more people that can talk about it and normalize it, and the more people that then identify with those people because they want to be like them and in totally separate areas of their life, it helps them realize that psychedelics can just be a tool and a part of your, a part of your, tool chest of life. So that's really exciting. And, I think just the last point on that is that's why I got into the space. And so that's what I'm excited to help, I guess, hopefully inspire other people in that way. I started following Michael Pollan and Tim Ferriss for totally separate things,
Yep.
like totally separate.
Yep.
And that's also why they brought so much legitimacy, because they built, these empires in business and wellness.
Yep.
And then they started talking about psychedelics,
Yeah.
which legitimized it on a whole nother level.
Yeah.
So I'm excited that people are talking about normalizing it. Last few questions for you is, what's next? Like, what's the most exciting thing that you guys are focused on?
Yeah. Yeah. I think, obviously some of the work for me, it's great that we've been successful to date. We've launched this company. It's worth more than it was when we started it. We've raised a significant amount of money. But it was funny. It was actually a phone conversation with my mom. My mom said, how do you think you're going to feel when like the first people do MDMA, even if it's research? How do you think you're going to feel when people come in and start doing psilocybin, the ketamine work even? And I said to her, I was like, I'm going to be a basket case. I'll probably be camping outside of the clinics, wondering, poking my head in the window, wondering
everything going well in there,
yeah,
guys.
That's right. So for me, that part is really exciting. We're at this point where like people are starting to go through research, and more and more people are telling their stories. The thing that I'm really excited about is for the everyday person who's going through treatment to tell their story to their community. I share my story, and I think the important thing is my story is not special. There's millions and millions of people that are suffering and have struggled with things, and the more that can be normalized, as we were just talking about, I think the better. So I'm really excited for some of that work to happen. Being up in Canada, Health Canada has continued to really move towards an accessibility model. They've granted Section 56 licenses where people have been able to use psilocybin for end of life anxiety and depression. So it feels like there's this tidal wave that is behind this space. And
you guys may even have Health Canada come in and work with the FDA potentially because of how much quicker it's moving, correct?
Correct. Yeah. And I think that's some of the exciting work. The fact that this is happening cross-border is really exciting as well. MAPS is even doing work in Israel and Australia, Europe. So it's this global movement really that's happening. And I think very shortly, even Compass has their results from their psilocybin for depression. Say what you will about Compass. I think all of that is really exciting and important. And I think what some of that research does is, I love that it's going through the FDA system, which the FDA clinical trial process was developed so that pharmaceutical companies could get their drugs approved. Now psychedelics are going through the FDA process to sort of disrupt that. And I think that is sort of cool to see that happening, and things come full circle a little bit. So yeah, that gets me really, really excited.
Do you have any, people in your life that it's difficult for them to understand what you do? Like, I don't know what kind of world you grew up in, but
it's funny. A lot of people were very aware of the suffering that I was going through. And so I think a lot of people saw the change that I went through in a pretty significant amount of time. My wife, for example, when I went to book that flight to go to Costa Rica, I said to her, look, like you have to trust me, but I'm going to do something different. And, she sort of looked at me and she said, so let me get this straight. You're suffering with severe chronic gut pain that you've had from your whole life. And your plan is to go drink some brew in the jungle for a week. That makes you super sick. Yeah. And I said, yeah, that's what I'm going to do. And, so I think, my mom, for example, who, as I mentioned, has been sober for over 20 years now, and very active in the AA community, has now gone and had her own journeys with psychedelics. And my mom wouldn't even take Advil. She was, she was that level of sobriety. But in seeing the shifts that myself and other people have gone through, found it important to go do for herself. And it's been amazing. So I haven't necessarily seen a lot of pushback, really. A lot of curiosity, a lot of questions for sure. but it seems like psychedelics in general, and I think it's because of the current mental health landscape, is everybody recognizes that there needs to be changes in how we treat mental health. And I think that's, why there's just been this huge adoption and inclusion of psychedelics.
I think also, for your family members that see you go through this transformation, and also people around you that hear you talking about psychedelics, see you're a very high functioning human, so that's it's important for people to associate these substances with people that they also want to be like and they respect.
True.
So I love how much you're speaking about it, even just coming and doing things like this, like coming on a podcast and sharing your story. I think it's so important because people connect with story, and your path to get here makes a lot of sense. And really, I think paints a really clear picture of the integrity behind what you're doing.
Thank you.
Yeah.
I appreciate that.
All right. So my last question for you, and then want to know where people can find you, is if you had, given this is a mushroom podcast, we like to bring it full circle.
Yep.
But you can answer with psilocybin or any other psychedelic. But if you had to pick one lesson that the best lesson that you've learned from psychedelics that has changed the way that you go about your life, what would it be?
Gratitude, more than anything. And gratitude for just the way that things are. My chronic pain left the day that I essentially just gave it gratitude and was thankful for it. And I didn't try and fix it. There's nothing wrong with me. I'm perfectly fine. There's experiences in my life that have granted opportunities for me to develop as a human being. But I think just gratitude for my life, gratitude for all of the opportunities that I've had to try and overcome. And yeah, I think, again, I get to sit on a podcast and get to masquerade as a psychedelic CEO. I think that's a pretty incredible thing to be able to do. So, yeah, just deep gratitude for myself and the recognition that while lots of people are suffering with things, nobody's broken or needing fixing. They need to just return back to themselves. And that was a huge lesson for me with psychedelics, for sure.
I love that.
Yeah.
And I think, so much of what my team and I talk about is just the importance of being really, there's so much suffering going on, but what's so amazing about this space is that just paints this wild optimism about the future if it's done correctly. So, while it's important to give acknowledgement to all the suffering that's going on, there's just so much excitement if this can, be done correctly to help so many people.
Yeah.
So I love that. Okay. So where can people find you, whether it's on Instagram, Numinus as well?
Yeah, Numinus on Instagram, numinus.com is our website. I really encourage people. There's tons of information that we share just about what we're doing in the industry in general. We have a great newsletter, so if people are interested in hearing more, we share a lot of information just about psychedelics in general, not just what Numinus is doing. And then myself on all the social traps that...
first and last name, which we'll link.
Yeah, first and last name, which, might be better if you link because it's tricky for people.
It's a bit tricky. We'll link it.
Yeah, cool.
And the last thing I guess we'll end on is exciting news that you said was public, so we're okay to share, is that you're looking at expanding into the US with some clinics. So we'll be on the lookout for that win.
Yeah, hopefully for the early part of next year, if not before the end of the year this year. So
amazing.
Yeah.
Okay, well, I can't wait for that and can't wait to chat more with you and dive in.
Thank you for having me.
Yeah. Thank you guys so much for joining us on another episode of Into the Multiverse, and we'll be back next week. Thanks for diving into the multiverse with us. If you're interested in being a future guest on the show, sponsorship, partnership, or you're just mushroom curious, we're always looking to expand our mycelium network. Find us on Instagram at Multiverse or online at yourmultiverse.com. See you next week.